Hello, welcome to my YouTube channel. My name is Dr. Gordon Ambayo. I'm a consultant psychiatrist. I'm a lecturer at Kenya Methodist University and the chairman of the Department of Psychiatry at the Kenya Methodist University. This video is on dopamine pathways. I'm going to talk about the 4 dopamine pathways involved in the pathophysiology of schizophrenia and side effects of antipsychotic treatment. There are normally 6 dopamine pathways, but I'm not going to discuss the other 2 which are not involved in pathophysiology of schizophrenia and side effects of antipsychotic medication. Please help us fight stigma around mental health and encourage those who have mental illness to turn up for treatment. If you like the video, please click the like button and also subscribe. So the dopamine pathways are also known as dopaminergic pathways or dopaminergic projections. They are in the human brain and are involved in both physiological and behavioral processes, including movement, cognition, executive function, reward, motivation, and neuroendocrine control. Each pathway is a set of projection neurons consisting of individual dopamine neurons. Now, the 4 major dopaminergic pathways involved in schizophrenia pathology and treatment are the Mesolimbic pathway, the Mesocortical pathway, the Nigrostriatal pathway, and the Tuberoinfundibular pathway. Now, the Mesolimbic pathway and the Mesocortical pathway form the Mesocortical limbic system, which also is involved in addiction. Now, 2 other dopaminergic pathways not involved in schizophrenia pathology are the hypothalamo-spinal tract and the insato-hypothalamic pathway. Now, there are certain conditions that and diseases that are involved in these dopaminergic pathways. Diseases like Parkinson's disease, attention deficit hyperactivity disorder, substance use disorder and addiction, and restless leg syndrome. As I said earlier on, there are 4 major pathways involved in schizophrenia, and these are Mesolimbic pathway, Mesocortical pathway, Nigrostriatal pathway, and Tuberoinfundibular pathway. We are going to discuss each one of them, and this diagram shows each of these pathways. Mesocortical pathway is the blue one, starting from ventral tegmental area in the midbrain to nucleus accumbens. We have the Mesocortical pathway starting from ventral tegmental area to the cortex. Then number 2, we have Mesolimbic pathway starting from ventral tegmental area to nucleus accumbens. Then we have the Nigrostriatal pathway, which starts from the substantia nigra to the stratum. And then we have the Tuberoinfundibular pathway, which starts from the hypothalamus to the pituitary gland. So this is another diagram showing the pathways in more detail. What happens in the dysfunction of this pathways? Dysfunction of specific dopaminergic pathways leads to Parkinson's disease, attention deficit hyperactivity disorder, substance abuse, that's addiction, and restless leg syndrome, which is also known as Willis-Ekbom disease. This is another diagram showing us the pathways. Now, how is dopamine synthesized? Dopamine neurons of the dopaminergic pathways synthesize and release the neurotransmitter dopamine. Enzyme tyrosine hydroxylase and dopa decarboxylase are required for dopamine synthesis. These enzymes are both produced in the cell bodies of dopamine neurons. Now, dopamine is stored in the cytoplasm and vesicles in axon terminals, and dopamine is released from the vesicles. Now, the axons of dopamine neurons extend the entire length of their designated pathways. Now, the mesolimbic pathway, also referred to as the reward pathway, transmits dopamine from the ventral tegmental area, which is located in the midbrain, to the ventral stratum, which includes both nucleus accumbens and olfactory tubercle and the amygdala. The meso prefix in the word mesolimbic refers to the midbrain, or the middle of the brain, since meso means middle in Greek. Its function involves reward-related cognition, incentive salience, that is wanting, pleasure, liking, and response from certain stimuli, and positive reinforcement. When you go to the tegmentum, is from the Latin word covering, and this area is area within the brainstem. The tegmentum is the ventral part of the midbrain, and the tectum is the dorsal part of the midbrain. The amygdala is a key component of the mesolimbic system and associated with emotion. Mesolimbic pathway is involved in conditions such as addiction and depression. Again, that's a diagram of the pathways. So this is a diagram emphasizing the mesolimbic pathway. As I said earlier on, it starts from ventral tegmental area to the nucleus accumbens, and is depicted there in red. The mesolimbic pathway regulates incentive, motivation, reinforcement learning, and fear, among other cognitive processes. Mesolimbic pathway is involved in motivational cognition. Now, pathology involving mesolimbic pathway, we have diseases like attention deficit hyperactivity disorder, addiction, and schizophrenia. Excess of dopamine in mesolimbic pathway is responsible for the positive symptoms of schizophrenia. Now, the positive symptoms of schizophrenia are hallucinations, delusions, confused thoughts, and disorganized speech. There is also trouble concentrating and movement disorders. Now, we go to the mesocortical pathway. The mesocortical pathway transmits dopamine from ventral tegmental area to the prefrontal cortex. Again, as I said earlier on, meso means midbrain and refers to the ventral tegmental area, which is located in the midbrain, and cortical refers to the cortex. Mesocortical pathway is responsible for the verbal memory and executive functions. Dysfunction of mesocortical pathway is involved again in attention deficit hyperactivity disorder, addiction, and schizophrenia. Deficiency of dopamine in mesocortical pathway is responsible for negative symptoms of schizophrenia. Now, in schizophrenia, there is less dopamine in the mesocortical pathway, leading to negative symptoms of schizophrenia. And the negative symptoms domain consists of 5 key constructs. There is the blunt affect, alogia. Alogia means reduction in quantity of words spoken. Avolition, a reduced goal-directed activity due to decreased motivation, asociality, and anhedonia. Anhedonia means the patient has reduced interest in pleasure activities that they used to have pleasure in. Now, antipsychotics reduce the little dopamine in the mesocortical pathway, leading to secondary negative symptoms of schizophrenia. Next is nigrostriatal pathway. The nigrostriatal pathway transmits dopamine from the substantia nigra pars compacta to the caudate nucleus and putamen located in the dorsal stratum. Now, the substantia nigra is located in the midbrain. The nigrostriatal pathway is responsible for motor function, that is voluntary movement, reward-related cognition, and associative learning. The nigrostriatal system contains about 80% of the brain's dopamine. Dopamine controls level of acetylcholine in the nigrostriatal pathway. As antipsychotics reduce dopamine in this pathway, leading to excess acetylcholine, which leads to extrapyramidal symptoms. It is involved in addiction, chorea, Parkinson's disease, and extrapyramidal symptoms of antipsychotics. Now, a degeneration of dopaminergic neurons in substantia nigra, pars compacta, is one of the main pathological features of Parkinson's disease, leading to marked reduction in dopamine function and symptomatic motor deficits of Parkinson's disease, including hypokinesia, tremors, rigidity, and postural imbalance. The condition caused by decreasing dopamine in nigrostriatal pathway is called Parkinsonism, as opposed to Parkinson's disease, which occurs naturally with the reduction of dopamine in substantia nigra. Now, the decrease of dopamine in nigrostriatal pathway caused by antipsychotics leads to increase in acetylcholine, and this is why anticholinergic drugs such as benzexol are used for treating extrapyramidal symptoms. Now, tuberoinfundibular pathway. The tuberoinfundibular pathway transmits dopamine from the arcuate nucleus, that is the infundibular nucleus of the hypothalamus, to the pituitary gland via dopamine release into the median eminence and subsequent circulation through the hypophyseal portal system. The pathway influences the secretion of certain hormones, including prolactin, from the pituitary gland. The infundibular, in the word tuberoinfundibular, refers to the cup of the infundibulum, out of which the pituitary gland develops. The activity of dopamine in this pathway inhibits the release of prolactin. Inhibition of dopamine in this pathway leads to hyperprolactinemia. Hyperprolactinemia can lead to galactorrhea, gynecomastia, and amenorrhea, and it can also lead to infertility, decreased sex drive, and bone loss in both males and females. Now, high prolactin levels inhibit secretion of follicle-stimulating hormone, which is the hormone that triggers ovulation. High prolactin levels also reduce luteinizing hormone. So high prolactin levels lead to suppression of ovulation and therefore infertility. Now, in males, too much prolactin can lead to decreased sperm production. Thank you for watching, and in case you would like to contact me, my mobile number is 0722 396986, and my email address is drambayo15@gmail.com. Do not forget to subscribe so that you can receive notifications for my future videos.